Welcome to the program. As of midnight tonight, Victoria will join Sydney under lockdown as the highly infectious Delta variant spreads across state borders. The Andrews government has opted for a 5-day snap lockdown, with the state's contact tracers scrambling to contain the outbreak.
This is so infectious. This is such a challenge that we must do this. You only get one chance to go hard and go fast.
Melbourne's latest outbreak started last week when 3 removalists arrived from Sydney. 2 later tested positive for COVID-19. The crew delivered furniture to a home in Melbourne's north and collected goods from an apartment block in the inner west. They then travelled to South Australia for another delivery, stopping at a petrol station before finally returning to Sydney. CCTV footage has revealed the removalists were not wearing masks.
I need people to understand just how serious this is and how close we are to imposing further restrictions on the community of South Australia.
Today, Victoria's outbreak grew to 18 cases, mostly linked to the removalists. One, a man in his 60s, attended an AFL match at the MCG last Saturday. Since then, 3 more people at that game have tested positive, sparking fears it could become a super spreader event.
Our real focus is the MCG. We need to establish whether there are any other people who are at the MCG if they're positive. That's a critical bit of information we need to get to today.
The state is now dealing with 75 exposure sites, 1,500 primary close contacts and 5,000 secondary contacts. Meanwhile, COVID continues to spread across the country. Today, Queensland recorded 3 new community cases, while New South Wales reported 65. Professor Tony Blakely is an epidemiologist at the University of Melbourne, and Professor Catherine Bennett is the Chair of Epidemiology at Deakin University. If I could ask you first, Tony Blakely, is 5 days long enough?
I think so. But first of all, things have changed a lot today. At the beginning of the day, I thought we'd get away without a lockdown, but that transmission happening at the MCG is a complete game changer. It just shows you how quickly this is moving. 5 days is exactly what I would have picked as well, because it's the average incubation period and will hopefully be enough time to see whatever change of transmission we don't know about out in the community extinguish if everybody's at home, and certainly give the contact tracers enough time to get ahead of it. So 5 days is what I would have picked as well.
Well, Catherine Bennett, if we look at New South Wales, the Premier has suggested today that the numbers have started to stabilise. We're not getting exponential growth in the number of people who are infectious in the community. Do you think that's right? And what does that mean if she is correct?
Well, I think, we saw the numbers really peak quickly above 100, but some of that was catch-up. They were finding cases a week old. And the concern, though, has always been these cases that they're finding well and truly after they've been infectious and out in the community. Those numbers for the last week or so have been in the 20s. They haven't really peaked up too much beyond that. They went up into the 30s if you count the people who are out for a day or so before they're identified. But that's the critical number. That tells you not only do you have more exposure sites even under lockdown, but also that we're still not getting to those cases fast enough to have a chance to get their contacts into quarantine before they're infectious. That's how you close an outbreak down. So we're still a step behind. It's not taking off. The lockdown and all the efforts everyone's putting in are controlling it, but we've still got work to do to get in front of the virus, and that's the critical thing, and much harder with the numbers they have in New South Wales than we have in Victoria.
Tony Blakely, you've done some work which we've talked about before at the University of Melbourne on modelling the various variables in this equation. What do they tell you about what's happening in New South Wales?
Well, I think Catherine's been too generous in her comments, actually. I think having 36 cases out there in the community, which have been in the community whilst infectious, is incredibly concerning. And if you've got the type of lockdown, half lockdown that you've got in New South Wales, in all probability, those cases are just going to come down so slowly that the cost of that to society in GDP terms compared to going into a hard lockdown and bringing it down fast is probably greater. And you've now got spillover effects to Victoria with having to go into lockdown. So basically what our modelling says, the Bennett Institute, Prokopenko and University of Sydney, all of us agreeing furiously that for a virus as rapidly spreading as this Delta, when you've got an outbreak, certainly the size of New South Wales, you lock down hard and get it over and done with quickly. Otherwise, it drags on with consequences we don't like.
Well, Catherine Bennett, talking about things spreading quickly, what's the chance that what we're seeing now in Melbourne and in Victoria is the sort of start of a super spreader event coming out of that football game at the MCG?
Well, they've got a lot of work to do to figure out what crossover points there might have been between the case and those other unrelated people who've picked up the virus. They weren't sitting close, they were outdoors. But the question is whether they did have that opportunity as they made their way through the stands or to using facilities where they might have had that connection. We saw it in the Coles interaction. We thought it was just a random person in the store and people wear masks in stores. But in fact, it turned out the person had a conversation with the very case. So I'm actually hoping that we'll find that there was that crossover point, because otherwise, you know, there's that risk that you have had a lot of people exposed, and these very casual exposures can lead to cases. The good thing about the MCG, they have great contact ascertainment. They know exactly who was there. They can follow up the testing, and we'll find out whether that does in fact translate to a lot of transmissions, or whether it was really about those opportune, simple interactions, but just the wrong footfall into someone else's airspace that might have actually translated to these two cases. We hope so.
Catherine Bennett, Tony Blakely, once again, thanks so much for your time tonight.
Pleasure. Thank you, Laura.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.